Vitamin B6 plays a vital, often underrecognized role in early brain development, particularly during pregnancy and infancy, a period when the nervous system is forming at a rapid pace and nutrient needs are both elevated and highly specific. As the coenzyme form pyridoxal 5' phosphate (PLP), B6 supports the synthesis of neurotransmitters such as serotonin, dopamine, and GABA, all of which are not only important for mood regulation but also for the establishment of synaptic connections, neuronal signaling, and brain architecture. Despite its foundational importance, B6 is often present in only modest amounts in prenatal supplements, leaving a gap between maternal needs and fetal supply that can have lasting developmental consequences. During pregnancy, the demand for B6 increases significantly. This is due not only to the mother's increased metabolic activity, hormonal shifts, and immune modulation, but also to the growing fetus's reliance on B6 for neurodevelopment, red blood cell formation, and amino acid metabolism. PLP crosses the placenta and accumulates in fetal tissues, especially the brain, where it helps facilitate myelination and neurotransmitter balance. Even mild maternal deficiency can result in suboptimal B6 transfer to the fetus, which may impair early neurological development. In more severe cases, B6 deficiency during pregnancy and early infancy has been linked to overt developmental delays, irritability, failure to thrive, and, in extreme cases, seizures in newborns. These seizures are typically non-febrile and unresponsive to standard anti-epileptic drugs but resolve rapidly with B6 supplementation. Known as pyridoxine-dependent epilepsy, PDE, this rare but well-documented condition highlights just how essential B6 is to early brain function. While PDE is often rooted in a genetic enzyme defect, the fact that it is treatable with B6 further underscores the nutrient's neurological significance. Yet despite these established links, many prenatal vitamins contain only the minimum recommended amount of B6, typically 2 mg to 3 mg, barely above the daily requirement for non-pregnant adults. This amount may be sufficient to prevent gross deficiency, but likely falls short of optimal levels needed to support neurodevelopment in high-risk pregnancies, including those complicated by gestational diabetes, high stress, poor diet, or chronic inflammation. Some more advanced formulations include higher doses or the bioactive PLP form, but these are the exception rather than the rule. The broader prenatal supplement industry still focuses primarily on folate, iron, and calcium, often treating B6 as an afterthought. The underrepresentation of B6 in prenatal care may also stem from a lack of immediate, visible symptoms. Unlike folate, whose deficiency can lead to dramatic neural tube defects, or iron, whose absence causes anemia, B6 deficiency typically presents with more subtle and delayed outcomes, such as behavioral issues, irritability, or impaired stress response. These effects may not be clearly evident until after birth or during early childhood, by which point the opportunity for prevention has passed. And because they're not always recognized as nutrient-related, they often go untreated or are approached solely from a psychological or pharmaceutical angle. Adding to the issue is that certain populations are at higher risk of deficiency during pregnancy. Women with morning sickness may eat less and lose nutrients through vomiting. Those with high protein intake may burn through B6 faster due to its role in amino acid metabolism, and those on medications, such as isoniazid or birth control prior to pregnancy, may enter gestation already depleted. Yet, comprehensive screening for B6 is not standard practice, and even functional symptoms are rarely linked back to the vitamin. This blind spot also extends into infant nutrition. B6 is naturally present in breast milk when the mother's levels are adequate, but formula-fed infants are entirely reliant on fortified sources. Although most formulas now include B6, the early weeks of life are delicate, and even minor lapses in intake or absorption can have disproportionate impacts on brain chemistry and development. In cases of unexplained seizures or neurological symptoms in infants, B6 status is often not investigated unless a physician is specifically aware of the link, which many are not. In conclusion, vitamin B6 is an unsung hero of early neurological development, with critical implications for pregnancy outcomes and infant brain function. While its role in preventing developmental delays and seizures is well documented in the scientific literature, it remains underemphasized in both prenatal supplementation and pediatric care. The minimal doses found in most prenatal vitamins may be insufficient for optimal neurodevelopment, particularly in at-risk populations. Closing this gap requires greater awareness, improved formulations, and a more integrative approach to maternal and infant health, one that respects the biochemical intricacies of brain development and ensures that foundational nutrients like B6 are not left behind.